This is Tom Radacki. Today I'm introducing my good friend Peter. He's one of the best physical therapists I've ever worked with. He's got 15 years of experience, and today we're going over the knee secrets. If you have swelling, irritation, pain in your knee, and you chronically during the day, it aches, it swells every day, you have to rest and it gets worse. Sometimes it's an injury, but the vast majority of the time, it's alignment issues, it's strain, it's overuse. And we're gonna show you the 6 easiest exercises to start straightening your knee, your hips, and your feet. And we're starting now.
I've been working as a physical therapist for approximately 14 years in the outpatient orthopedic setting. This is ideal for acute pain, recent strains, flare-ups, if you tweaked your knee, you have active inflammation, if there's swelling, if it's warm, if you're moving around and everywhere you're going or anything you're doing, you're having pain, this would be a great starting point. The primary muscles surrounding the knee joint, which would be the quadriceps, the hamstrings, the calf muscles, it would be the upper calf muscles called the gastrocnemius, and these all cross the knee joint. A big part of the knee rehab is hip strengthening as well, just because it provides the proper alignment for the leg. As soon as that leg hits the ground, you want your hips to be strong and you want your ankles to be strong. If you don't, then what ends up happening is it affects how the knee moves, and it can create a lot of strain and irritation at the actual knee itself. This is, like I said, this is a series of 6 different exercises. This is Lena, who's going to be our subject here, who's going to be modeling some of the exercises for us. 6 foundational exercises that work great for the early rehab knee pain, when it's flared up, when you got the acute pain, swelling, inflammation, stuff like that. The first one we're going to do is something called quad sets. And the easiest way to do it at the house or really anywhere is just to get a roll-up towel. You could use a towel, you could use a couch cushion, you could use a pillow. It doesn't really matter as long as you have something to push against and something that's comfortable. You can do this on the carpet, on a rug. If you do it on a firm floor, it's a little bit uncomfortable. If you do, you can get away with doing this on your bed as well. I mean, it's kind of, you can try it out and see if it works for you there. So go ahead and straighten out your leg in this case. Keep your one knee bent is nice because it does support your back a little bit better. So for this exercise right over here, you're basically going to imagine like you're trying to squeeze your thigh muscle, this right here, the quadriceps, as you're pushing the back of the knee down into the towel, the pillow, whatever you end up using. Now, if the leg lifts up a little bit right over here, that's completely okay. We're focused on getting the thigh muscle to turn on. When there's knee pain, when there's swelling, anything like that, what ends up happening is the muscle literally deactivates, turns off, and it doesn't fire as well and doesn't provide this knee stability that you need. So it actually increases the irritation that can develop in that knee area. So we're going to do this for a 5-second hold, 5 to 10-second hold ideally, and we can do it for 2 to 3 sets of 10. So the next exercise we're going to do is called the short arc quads. It's going to be, again, a quad strengthening, muscle activation, a neuromuscular exercise as well. This one could be advanced with an ankle weight, and I'll show you in a second how to do that. But basically, you're going to be straightening the leg out and just kind of lifting the heel up off the table and holding that just for a couple seconds and then right back down. If you want to hold it for 5 to 10 seconds, I think that's great, actually. That's generally the way I like to do it. Perfect. And again, you're going to start noticing a pattern. 2 to 3 sets of 10 is usually a good starting point. It's usually comfortable, and you can, add and subtract from that usually. So if you're doing 2 sets of 10 and it's too much, drop it down a little bit if you need to. If it's too easy, of course, you could advance it. And then with the ankle weight, it's exactly what it sounds like. You're just going to put it around the ankle. It's going to add more resistance, so it's going to be a little bit more challenging for you. So it's a nice step in that direction as we start to advance the program. Okay, so now we moved on to the hip strengthening portion of this program. Just like I mentioned, the hip strengthening is huge. It provides the proper alignment for the entire limb when you're walking. If you don't have enough strength in the hip, your knee's going to move inwards like a valgus motion, and that creates a lot of strain on the knee. With squatting, going up and down stairs, lunging, getting up and down from a chair. So the hips always have to be included in any good knee program, or knee pain strengthening program, or knee pain program. So in this case, we're going to start off with something very simple called the clamshells. I'm going to show you an advancement really quick, but I want to show you the most basic way to do it. So you're just in this position on your side, knees bent. You want to keep your ankles together, and you're going to lift your knee up towards the ceiling and then right back down. And we're going to do that again for 2 to 3 sets of 10. And we'll put the details in the show notes for you, so that way you could reference it. So what this is doing is strengthening the hip external rotators, and this is kind of what we would do, and this is what we would start with. The advancement that I really like for this is if you can get a band, you could put that around your knees and then do the exact same thing. The only difference is now you have a little bit of a band here. And this is wonderful because now you're providing more resistance. It shouldn't be bothering your knee because you're not really moving at the actual knee joint. You're trying to kind of keep that still. And if you want to get really crazy, you do both sides. Even if one side's bothering you, I think it's always great to do any of these on both sides, because if the other side isn't bothering you, what's great is you're more likely to prevent any future problems. So then that would be the clam shells. What I want to go to next, this is called, there's a lot of different names for it. Sometimes it's just clamshell number 2, clams level 2, advancement level 2. We call it the fire hydrants. I know it sounds funny, but it's basically kind of the idea with the dog and the fire hydrant idea. So you're bringing your knee up towards the ceiling and the ankle up at the same time, and then right back down. And again, 2 to 3 sets of 10. So this is a little bit harder as far as strengthening and challenging the muscles than the first 2 exercises we just did. So the next exercise is called the hip abduction. We do this in sideline. It's basically the hip abductors, gluteus medius is the big one we're focusing on right now. It's very important, again, the pelvic alignment, the limb alignment, when you're walking, squatting, lunging, and so on and so forth. The first 2 included more strengthening for the external rotators, as well as some hip abductors. This one tends to isolate the hip abductor a little bit more. I like to kind of keep the body straight. You're going to keep the leg almost back just a little bit, and then you want to make sure your pelvis isn't rotating backwards. And you're going to kick this leg straight up towards the ceiling and then right back down. Now this will be surprisingly challenging, even though it doesn't look like that hard of a muscle or that hard of an exercise to actually do. The interesting thing is these muscles are weak on almost everybody. Doesn't matter who we've treated. So it's very important to do this with a good form. Your leg will want to gravitate forward as you get fatigued because these muscles on the front will want to compensate. Don't let it. You want to keep it slightly back as you're going up and down. And then try not to do it with momentum. You want to go slow. So if you're kind of whipping it up, that is going to be easier, but you're more likely to injure your back or irritate your back, and you're going to get less of the actual activation at the proper muscle, less strengthening at the proper muscle. So this exercise is called hip circles. You're doing it in the sideline position. It's similar to the hip abduction in the sense that we're activating the right muscle or that same muscle. We're strengthening that same muscle. You can, for any one of these, you can add an ankle weight as well. So if any of them are easy and you have a 1 or 2 pound ankle weight in the house somewhere, feel free to do so. I mean, you'll know your body. You'll know if you're straining. You shouldn't be feeling it in the back. It should just feel like that workout muscle burn sensation. So for the hip circles, exact same position. You're going to lift your leg up, and then you're going to do small softball-sized circles. You're going to do 10 one way. Good, good, good. And then the other way now. And 10 the other way. Now this one actually will feel a little bit like a killer just because it's going to burn a lot of that muscle. So you won't really need that much of a weight initially, but you can advance it that way at one point. Are you feeling it?
Yeah.
Good. Okay, cool. And you want to do it consistently. You could do that 3 times a week, I think is great. Like I said, 2 to 3 sets of 10 for each exercise, the 5-second and 10-second holds for the isometrics or for the ones I mentioned in the video.
The big secret with hip, knee, and foot alignment is to get a physical therapy evaluation or a postural exam. I do this in clinic. Peter does this as well. And in fact, I've been talking to Ben Foster, the knees over toes guy, and we're putting together a guide to do a postural exam. We're looking at your back, your hips, your knees, your feet, your toes, and all the muscles in between. And we're going to give you the best stretches, the best exercises, the best tools, the best orthotics, the best shoes to get you aligned. Check out our 30-day course where we go over all of these devices.